Hello, everyone, and welcome back to Prescription for a Change, the podcast where we challenge the way we think about health and step into a more intentional, whole body approach to living well. I'm your host, and today's episode is one that I know you do not want to miss. We'll be talking about the intersection between what we've been told and what we're actually experiencing with our bodies. In this space, everything may look normal on paper, but you still don't feel your absolute best, and you know deep down that something is not right. In this episode, we're diving into what it really means to bridge the gap between traditional medicine and functional healing, especially when it comes to gut health and fertility. The truth is, both approaches have value, but when we learn how to connect them, that's where the real transformation begins. Today, I'm so happy to be joined by Danielle Hively, a functional nutritional therapy practitioner who helps to uncover the causes behind chronic gut issues and supports individuals and couples on their fertility journey through a more personalized whole body approach. So this conversation will not only be insightful, but it will be practical and honestly empowering. So I've been looking forward to hearing some of these answers myself, and I'm ready to help all of you understand your body on a deeper level. All right, let's get into it. Danielle, thank you so much for joining today. Can you start by just giving a little bit of an introduction of yourself and how you got into this space?
Sure. Thank you so much for having me, and hello to all of the wonderful listeners. But I am Danielle Hively. I'm an FNTP. I've been in this space since 2017, and I originally kind of got into this after my college graduation in 2008. I ended up going on this wonderful college trip to the Dominican Republic, and unfortunately got really sick there on my last day. So that was a huge blessing. But once I returned home, I did get admitted to the ER, and it was just kind of this journey where the doctors and professionals there couldn't really explain or tell me why I was feeling the way I was feeling, and ultimately how I could get better. So I received some IV, some fluids, some antibiotics, and things like that. But those next several months after that original trip in June just were not the same. So I ended up having all of these GI issues. I all of a sudden couldn't tolerate dairy anymore. And it was just kind of, I was running around, I felt like with a chicken with my head cut off, trying to figure out what was going on. And I just kept kind of getting the same answer of, it's probably just your stomach and that's how it's going to be. And I was only 21 at the time, so I really refused that narrative. And I thought, gosh, I really got to figure this out. So I dove kind of head first, did a bunch of research, and ended up putting myself on a couple different common over-the-counter supplements, and honestly felt better within those first 30 days. So that just really opened my eyes that there was other solutions, there were other answers to overall healing. And I hadn't really thought about that before. I wasn't one, that would refuse prescriptions or medications or anything of that sort, but I certainly was feeling very frustrated. So after that, I just decided, well, I'm going to go back to school, and I really think I want to help people, and I'm going to dive into this a little bit. So that's exactly what I did. And I would say just my focus now has kind of evolved over time, over the last 8 to 10 years. And I think it's just been a really beautiful kind of experience. I think, in this space too, it's always important to continue education, but your passions, tend to change a little bit, and your personal experiences contribute to that as well. So that's really what led me here.
Oh my goodness, that is so awesome. Thank you so much for sharing your story. There were a lot of key elements there, but one of the things that really stands out for me is the fact that when this happened, of course, it's a very scary experience. You're in a different country and you're so young. And just being able to navigate the space of medicine, and, it doesn't matter what age you are, it's very difficult to navigate the space, even in the States, and figure out exactly what's going on for your own health. And then really just taking that initiative to say, you know what, I know like this is not how I want to live the rest of my life, right? You know that there's something else that you can do, and really listening to your body, I think, is important. So thank you for sharing that. I hear all the time, and I'm in the pediatric space, so I'm seeing really littles, newborns up to adolescents. And so as children are even at younger ages, like school age, they're starting to really like listen to what their body is telling them. And then of course, as you get older, you may just kind of think this is the way it is because I'm getting older. So I kind of hear all the time, everything looks normal on my labs, but I don't really feel like myself. And what do you do with that? What's really going on there?
That's such a great question. And I do think that's probably part of, what we're taught essentially, or maybe not even what we're taught, but what we see right? Online and especially
Mhm.
social media, and probably a lot of what our parents have told us that, oh, that just kind of comes with age, the aches and pangs and things of that
Mhm.
nature. But really, when you look behind the surface, there is always more to that story. I always tell
Mhm.
clients that symptoms are your body's way of communicating to you. So we have to kind of take it as your body sending you a text, it's giving you a phone call, it's sending an email. There's all these different ways your body can transmit what it's experiencing through our
Mhm.
symptoms. And so there's certainly not something to be ignored, because that is the only way that your body can clearly communicate to you. So
Mhm.
when somebody is going in with symptoms and they're sitting down, with a doctor or specialist, and they're saying, gosh, I'm really, I'm dealing with insomnia. I have these headaches, that come every 1 to 2 weeks before my cycle. I'm dealing with, nonstop bloating, the acid reflux, whatever it may be. It doesn't really matter, right? If a doctor tells you that, oh, your labs look normal, they look okay, because you still have to listen to those symptoms. The symptoms
Mhm.
will always trump what that lab value is saying. And I think, to go aside that is really myself and other people in the functional medicine space, we're really trained to look at labs using different ranges. And so that's a discrepancy as well, is that when you go to your functional lab practitioner, somebody like myself, I'm going to be using very narrow ranges that have been developed over years by other functional medicine practitioners versus your standard doctor or specialist who's using what we call conventional or standard ranges. And those ranges are very wide. So by the time, you meet with that doctor, they're looking at those ranges. For instance, the white blood cell for conventional could be 3.4 up to 10, sometimes 11. By
Mhm.
the time you fall out of range there, you're already looking at a situation of a diagnosis. And
Mhm.
there's no fault, to the doctor, the specialist. That is what they're taught in school. But again, it's just a different way that we view things, right? We're viewing them narrowly, and the narrow passage and pathway really gives us that tool to create patterns. And patterns are the ways where we can say, gosh, if you're dealing with that bloating, you're having that acid reflux, we can look at all of those different patterns on your labs and say, well, this is pointing to low stomach acid. This is pointing to things like leaky gut, to systemic inflammation. This actually kind of looks like there could be, a bacterial or viral infection at play. Let's dig a little bit deeper. So it's just a
Mhm.
different mindset. I do have a wonderful client who's currently in medical school in New York, and it's just been really fun. She's been with me for almost 3 years. And it's such a cool, insight for her, because she is being taught, what I just shared, but she also
Mhm.
knows my side, so she's going to be able to kind of combine the two. And so I just think there's both places, in the medical field, both where we should exist. But we really do
Mhm.
need to come together to understand that we're listening to the client, to the patient, and
Right.
hearing them out from that symptom standpoint. And like I said, even if they're trained to say, oh, these labs look good, you still have to dig deeper. I'm not a doctor, but I know that you take an oath, right, to everything is in the best interest of the patient, right? And so I
Mhm.
think that piece of it is kind of just missing, where, you dismiss those symptoms and all of that. So what I would say is to always dig deeper. Your symptoms still trump that. That is your body's
Mhm.
way of communicating to you.
Yeah, and you being the person who is coming in, the patient has to live with that, right? You're feeling those things. So hearing everything is normal, I know is not exactly, maybe a sign of relief that there isn't anything outright that pops out that's wrong, or anything, that's going to be either chronic or detrimental, but you're having the
Mhm.
symptoms. So there's something else. And whether it's stress, I always just say like mental health and everything else,
Mhm.
like how you're feeling, your stress levels, that all contributes to, like, you can have physical manifestations of what's actually going on. So there's so many different ways that functional medicine, just taking a whole body approach, is going to be helpful. The other thing that I love that you said is about the labs, is that actually when we're looking at conventional numbers or ranges as well, I always tell families, I'm like, this is a range, right? And there's
Mhm.
sometimes when things are just like below that range, it's just a snapshot in time. So I may even have people come back and say, you know what, let's recheck this in 3 months or in 6 months. Like,
Mhm.
let's try these things, whether it's diet or exercise
Mhm.
or just like trying to de-stress, and then come back and let's see what your labs look like. Because if
Mhm.
you're just like just at the border of normal, I'm afraid that you might just tip the other way, and we don't know when that actually happens or how long it took to get there. So I love everything that you said. Just, knowing what questions to ask, listening to your body, and not trying to dismiss those symptoms.
Yeah. And I think the other point too is, especially as a female, but is to really be your own health advocate. So I think in any field, any specialist, but especially just for women, we do typically see more doctors, than an average male client or male patient. And I think that is one of the most important things, is just being your own advocate. Nobody cares more about your body and your health than you. And so as long as you empower yourself, you really get up that gusto, to speak firmly.
Right.
We can all be nice, right? We still want to be nice. And yeah, you don't need to be mean or nasty, but you do want to stand firm and really speak what is true, what is happening in your body, to stand up, because that is, again, like I just tell every client that really, truly, no one cares more except for you. And so you have to, if that person isn't listening, then you got to find somebody else. That's the truth too.
Exactly.
Yeah. Don't be afraid to say, this isn't working for me. I need to explore other options.
Exactly. That's so important, is you're going to be your best advocate for yourself.
Yeah.
All right. And then when you're looking at someone's health as a whole, where does gut health fit into just every day? And why do you think it gets missed so often?
Yeah, gut health is really, it's kind of the start and end of everything, truly. I think a lot of people probably think it's more the brain, but our gut and our brain communicate together all the time. They're two best friends, the gut-brain connection. And so everything does start and end within the gut. I would say, all disease, right, starts and ends there as well. And so when we're thinking about it, it really should be at the forefront of our mind. But like I was sharing, I think a lot of people just kind of skip over. So many people are just so busy. And I just see this a lot with most of my American clients, is that we're constantly trying to achieve and get to the next goal. And we're just working off this long list of things that we need to check off. Whereas
The never-ending list.
The never-ending list, right? And if you travel to Europe, or even just some other country, right, you're into South America, parts of Asia and things like that, the lifestyle and how those folks are living just is entirely different. A lot of them are not driven by the same things. I think that's such a detrimental aspect, is really when we start to just kind of push those symptoms aside. We try and just, again, prioritize everything else above that, instead of just taking that time for ourselves and being intentional, right? That intentional health, what does that actually look like? And I just think because of the society, the stress aspect to it, that really high achieving, aspect, which again, that's not wrong, right? When we're thinking of those symptoms that may seem so common to folks, things like the acid reflux and the bloating, or it's the maybe only having a bowel movement every 2 or 3 days, that's just not how your body was designed. Those are not normal things that should be happening. And so I do think a lot of what we hear and see from other folks too influences other people to say, oh, that is normal. I talked to Sharon the other day, and then Sarah and Alex, and they're all dealing with constipation. They all have reflux. So that's normal for me too. But the goal is that none of that is normal, right? And so I just think, a lot of the gut health is either that, where folks are just kind of rushing around, they're so busy. And then a big part of it too, that I've seen in my personal experience, was that, again, those doctors really aren't trained in that. When I went to see that gastroenterologist, there was no experience in that department. It really was, okay, well, we can do a colonoscopy, we can take samples, we can send it to a lab, but that's really it, but there wasn't any basic talk of, are you eating calmly? Are you chewing your food? Do you have sufficient levels of stomach acid, digestive enzymes? How is the entire ecosystem of the gut and the subsequent organs that support gut function working? All of that just wasn't spoken to me. And I imagine, I'm praying that now it's much better, and those folks do have a little bit more education there. But I think, so often for a lot of people, they just blindly continue their days and really truly suffer through with all of those symptoms. I couldn't imagine, but I do. I've heard that from many clients where they themselves, were dealing with all of these GI issues and just continue to live on, forge on.
Because I think that's how it's supposed to be, right?
Yeah, they
Yeah.
do. They really just do think it's normal. I would say too, what we see is I don't have too many older clients, but the ones that do come that are in their late 60s, early 70s, a lot of them, and most of these are women, they're all saying the same thing. They're constantly dealing with loose stools. And that example that I just shared with you is directly, from one of them where she just said, well, I talked to, 5 girlfriends this morning and they all said they have that. And I said, oh, honey, well, that's not normal.
Right.
So I do think a
You're like,
lot of
they
it is
all need
that.
to come see you.
Well, yeah, I mean, I didn't say that, but I just said, gosh, that is just not a normal thing, So I think
Right.
that is just a big part of it. And us as females, we're such, we're in communication. We love being with other women. So I do think it's
Mhm.
natural for us to say, are you experiencing that too?
Right.
And so, yeah, I just think it's probably lack of education, which I do feel, and this is going off a little bit of a tangent, but I do just think in women's healthcare in general, it's really the uneducation aspect to it is just there. I think so many things are
Mhm.
missed from early childhood into young adulthood that these are things that they should be taught in school, or you should have the
Mhm.
option, to learn about them somewhere for free. Why not? Right?
Yeah, absolutely. And I love what you said about the gut kind of being the beginning and the end of everything. It's kind of like this biofeedback mechanism, is what I always say, right? Like your body's talking to itself, and your gut is talking to your brain, and your brain is talking to your gut. And sometimes that connection gets morphed because
Mhm.
of things that like our lifestyle. And it's so different too, just in the States, how we live here under this constant like stress. I feel that
Mhm.
stress is also like a big part of it. Like we're living under this
Yep.
constant stress. Eating on the go or skipping meals is not going to be good for gut health. Like you said, constipation or not having a bowel movement every day is not great gut health. Like that's how we get rid of our toxins and everything else. So I think people don't always make that connection to I'm feeling this way because of XYZ. Like what are really diving into how you're living your life and what things you're doing, not to place blame, but
Right.
to really sort through like what are some things that I can improve on, or what are some simple changes I can make first. It's very hard to kind of sit here and say, okay, you need to do this major overhaul and change all of these things, but really just taking like, okay, what is the one thing that I can change or one thing that I can do that's pretty simple? And that could be not skipping a meal, or
Yeah.
it could be sitting down and having your breakfast, right? Just being able to hear your body say, I'm hungry, or I'm full, or I'm satisfied, so that you can give it what it needs is really just like paying attention to what it's saying. So the other thing that I always love to do, and I say that no one's too young or too old for this, is a probiotic. I love a good
Interesting.
probiotic. Like we're not getting enough prebiotics in our food, and then having a probiotic. And it's just such like the gut, 70% of our immune system is living
Mhm.
in our digestive system.
Yep.
So you need a healthy gut if you want to stay healthy throughout the year. I take one, my kids take one
Yeah.
every day. So I love
Yeah,
it.
that's great. I would say I'm more about, so I'm not, I love the probiotic. I'm not a fan of taking that, but I do love probiotic foods. So
Yes.
so more of like the sauerkrauts. I do love encouraging
Mm-hmm.
that kimchi, which is so
Mm-hmm.
delicious. And I love challenging, people to try, right? To really kind of expand the palate, try those new foods, because I think, I don't know, there's such a beauty to that, right? To kind of saying,
Mm-hmm.
gosh, yeah, I actually didn't know how good this was or how supportive that is. But yeah, I agree. I mean, I think you're
Yeah.
exactly right. The pre is so important too, right? What essentially are we consuming those foods that support the actual
Mm-hmm.
good gut bacteria? So we have right around, 2.5 to about 3, sometimes
Yeah.
even more, 3.5 pounds of gut bacteria in our body at all time. They get depleted so quickly. And I love also talking about the postbiotic, those butyrates.
Mm-hmm.
Those butyrates are so impactful. And I find most people actually need that. I would choose the postbiotic over for
Of the
me.
three.
Yeah, for me
Yeah, and it would
personally.
be great.
Um,
I don't know what it's like in the adult space, but I know for
right,
children, especially, we have a lot of selective eaters,
right. The picky eaters. Yeah,
recommending like
yeah.
kimchi. They may not be willing to try it just yet, but always just kind of like incorporating it and getting it in there. And sometimes they don't even know what it is, right? Like it's just
Yeah,
exposure. Being
absolutely.
exposed to
Yeah.
it X amount of times is really going to help you too, be able to
I agree.
expand your
Yeah.
palate and get those foods in.
There's just such a lot. There's a lot too that we can gain, a lot of knowledge we can gain from other cultures and really, paying
Mm-hmm.
attention to what they're doing. And so I always do really love to look to, Asian cultures and society. They have excellent DNA and different profiles there. Certainly I have a lot, in terms of the Japanese, that I paid close attention to. And so I do think it's so insightful, to kind of see even the Mediterranean, right? There's just all of
Mm-hmm.
these bits and pieces of other societies and cultures that I think we can really pick up on and learn from, those different actions and practices into place. But that's great. And I think you brought up a good point too. It is so different when we're seeing our specialties, right? You primarily are in the pediatric, which is great. That is going to
Mm-hmm.
be really different than who I see. And I think it's so important when you're choosing, right, a practitioner, you want somebody in your field, in that expertise,
Right.
to provide you with the best education and resources for sure. So no, I love that. I mean, gut health is just, we could talk about it for hours, days.
Forever. I know.
Forever. Yeah, forever.
Yeah. All right. So the next question I have for you is just especially for busy, high achieving women. And you kind of alluded to this earlier on. We're just always trying to push through symptoms. You have that bloating, you have low energy. You notice, like, right around 3 o'clock, your energy is dipping and you're just trying to push through the day with another cup of caffeine. What would you wish high achieving women would stop ignoring?
I would definitely say that the idea that I don't have time, I would say that's
Mm,
probably the biggest thing that I hear, is that I just don't have time. I don't have time to sit down. I don't have time to make a good meal. I don't have time
mm,
to exercise, to move the body. I don't have time to put in stress relieving practices, right? It's that sentence. I don't have time. I think,
mm,
we all understand that really high achieving, both men and women. I would say that for both. But if you're a high achieving woman, you're also a mom or a caretaker. You could be caretaking for other individuals in your household. That is, again, it goes back to that intentional healthcare, right? That intentional practice of really prioritizing yourself. You will end up in burnout, right? If you
yes.
continue on that loop of I don't have time and replace, the end with whatever it might be, you will end up burning yourself out. And it's going to be much harder to climb out of that burned out hole versus starting now and putting into practice those very simple habits. And I love what you shared earlier too. It's not about, completely ripping up your whole life and saying, I have to do
Mhm.
a 360, burn it all to the ground, start over
Right.
again. We're not doing that. We're just saying, let's take one thing, right? Take one thing for
Mhm.
you. And I would say it is stress. I had a client yesterday, busy mom of two, also interested in conceiving again, and just constantly, stressed, running her children around. She's working. Her husband isn't, he's there, but he has a very high demanding job. So he's not around a lot. And the
Mhm.
biggest thing is stress management, so that is
Right.
more than any other supplement, more than even probably exercising. It is stress, because stress
Mhm.
is the number one killer of gut health, of brain health, of your hormones, if you're looking
Mhm.
to conceive.
Your
And
heart?
so great. We could
Yes,
everything. Yeah. The heart, the
everything.
liver, yeah, the pancreas. Insulin related issues there. It affects every single aspect of the entire body. And so that would be the place to start, is to put into practice one thing that you can do to help manage your stress better. And for some
Mm.
people, I gave the tip yesterday was, before you go to bed, just take 5 minutes and listen to calming Hertz frequencies. There are
Mm.
frequencies that have the ability to go into the brain, to go into the enteric nervous system and relax you. And that's it.
Mhm.
5 minutes. That you don't even have to do
Yes.
anything. You just press play and listen. That's it.
And
Just
lay there and you
lay
probably
there.
fall asleep.
Lay there.
Yeah.
Hopefully fall asleep. Yeah. So I think it's really that, those women, God bless them, they're doing so many things, they're wearing so many different hats. But I do
Mhm.
think, it has to be stress is number one before doing anything else. And no, the solution is not taking a supplement, because what stress
Mhm.
supplement can I take? Nope. It
Mhm.
has
Or
to be
sleep
habit.
supplement or yeah.
Right.
Yep.
It has to
I
be the
want something
habit,
to make me
right?
sleep.
Yeah, because we all want that quick fix, right? That's what we've been
Mhm.
taught. That quick fix gets even faster and faster as the years go on
Yes.
because, for the moment, right, we had Amazon Prime, 10 years ago? Oh, we'll get the delivery in like 3 to 4 days. Now it's same day
Mhm.
within 4 hours, right? And
Yep.
so we're
Yeah.
all trained to have that same mentality for our bodies, for every single thing, right? We don't have patience anymore. And I think that's really the next step is to dive into the stress portion of it and choose one
Yeah.
thing that can try and relax that nervous system.
Yeah, absolutely. You have to create time for the things that are important to you, right?
Yeah.
And I think
Mhm.
we kind of wait until it's a problem instead of being proactive with it. I get it's very difficult to do in the society where things are just constantly moving and you got to keep up with it. But if I do not get a good night's sleep or I feel stressed, then my whole day is already like messed up and I'm not going to be productive because I just need that time to, even in the middle of my day, sometimes I'll
Mhm.
just in between patients, like step away, de-stress, take the, couple of minutes I need to just breathe or get some fresh air or something, right? And it just kind
Yeah.
of resets you and gets you ready for the next patient. I hate the feeling of dragging.
Yes. Oh my
Yeah.
gosh. No, I love that. I think that's so important. And that made me also think of, gosh, my mom worked in the hospital for years. And I remember visiting her and doctors, you would see them outside smoke, chain
No,
smoking on their
back in
break
the day with this, yes.
because they're probably so stressed, and they're just like, well, I got to get this in. But
Hmm.
yeah, it is exactly that. If you can just step away, for a few minutes, that's really
Hmm.
all it needs to be, but I do, yeah, gosh, I can't say it enough because the stress is, it's an epidemic, truly. That's
Right.
why,
It is.
the realm for vagus nerve, new modalities, bracelets you can wear, things on your
Hmm.
neck. All of that is just exploding because stress
Hmm.
is such a problem now. It's
You're like
wild.
tracking it. I'm like, it's there. It's definitely there.
Yeah, I
The
know. And that
stress.
can be another trigger for a lot of people too, is all of these trackers, right? These devices. And
Hmm.
like, well, we got to find that balance. Is it
Right.
helpful for you or is that causing more stress? I didn't
Right.
sleep, but
Right, exactly. Like you already
balance.
knew that. Is it, kind of getting the good information? Like, how can you make
Right.
those changes? You're absolutely right. You don't want to
Yeah.
be overloaded with information and really just knowing how to interpret that. Like, what does that mean for
Yes.
you? Like you said, if it's taking the 5 minutes to de stress right before going to bed or to calm your nervous system instead of trying to find 500 other supplements and things that you can take would be great. So, that's really important to be able to. And that's a simple thing that I think people can do. Like, take 5 minutes.
It's 5 minutes. Yeah.
Doesn't
And it
take a
doesn't
long
even have
time.
to, yeah. If you're somebody that doesn't like, perhaps you're just kind of like, well, I don't want to listen to that. There's simple breathing practices that you can do as well. There is a
Mhm.
lot of other somatic practices, simply even just shaking out the body, just kind of jumping up and down nice and loosely. That's another
Mhm.
great, somatic modality that is very helpful and nourishing. And there's a lot of different things that you can do. But the whole point is to disrupt what you're currently doing because it's not working. It's almost that definition of insanity. Oh, I'm going to get a different
Yes.
result by doing the same thing. It's like, no, you're not.
Right.
You actually got to change it up. You got to break the pattern and start to create new
Mhm.
habits, new patterns. And that just comes with time. So I think as these folks start to bring in new modalities, new patterns of creating safety in the body, right? That's ultimately what's happening. Then they're naturally going to
Mhm.
gravitate more to that. And that's really important. And if you are a mom, if you're a parent, then you're also demonstrating those great qualities for your children. They're going
Mhm.
to see everything that you do. They're going to copy everything that you do. And so I
Mhm.
think you're also setting them up for success versus them seeing, well, we got to get to the next thing. Everybody eat in the car. Okay, cool.
Right.
Let's throw that away. We got to go. You throw them out. It's just you're creating already that sense of stress and anxiety in those
Mhm.
kids.
Yeah. Absolutely. I think this is really a good segue into fertility. A lot of times,
Mhm.
even some of the things that you've already talked about can be helpful for fertility and even just trying those things because they may seem silly at first. Like, sometimes I wrote some of these things to like de stress. Here are some ways you can calm yourself, as you said, like jumping around or movement, even just for a couple of minutes, de stressing, meditation. I always talk about like 5 finger breathing, like things that you can
Yes.
do that may seem
Yeah.
silly, but when you actually do it, it works. It works really well to
Mhm.
just kind of like reset your
Yeah.
brain and everything else. So, moving into fertility, what are some of the things happening beneath the surface, especially with gut health, that people don't always connect to conception?
It's such a great question. It's a loaded one for sure. But, as we go back to stress and we're thinking about that gut brain connection, right? So 70% of the immune system is in the gut, but also a lot of our neurotransmitters are made in the gut
Mm,
as well. And so that's also helping us control our emotions, how we're feeling throughout the day, serotonin, dopamine, tryptophan. And that makes such a huge impact because not only are those neurotransmitters going to play a really big role in our progesterone production and also help us manage testosterone and estrogen levels, but it's also going to play on our energy throughout the day as well,
mhm,
which is really key when it comes to fertility. And the biggest thing is creating safety, right? Women's body is not going to choose fertility and optimal pregnancy if it feels unsafe. And so that's
right.
kind of the most important thing. And again, it starts and stops in the gut. We also want to
Mhm,
consider the possibility of those trillions of gut bacteria and
mm,
what they're doing for us, right? There are
mhm,
certain bacteria that, if easily overgrowing, and even yeast, that's going to cause other discrepancies and issues in terms of our hormones, but more importantly, it causes inflammation. And I would
mhm,
say, it's probably stress is number one, inflammation is number two. And that just really goes back to balancing that gut microbiome. So for every woman, that comes to us, we're testing the gut. I love to do specific stool tests that I run, and we get that complete picture. We're able to see what's going on with those gut
mhm,
microbes. Are there overgrowing yeasts that we need to tackle? Are there low gut bacteria and also high? Because it does have to be in balance. And a lot of
mhm,
times we do see that. I think most of the time people probably hear the dysbiosis aspect, but the low gut bacteria, those bifido, those Bacter, those are all so, so important to also helping maintain inflammation levels, but then even
mhm,
curating and managing how specifically our estrogen gets processed. There's our enzyme beta glucuronidase that is,
mhm,
within the gut, and that allows us to properly clear and process estrogen in the body. So there's every aspect of the hormones is going to be a touch point, from the gut in some way or fashion. And I would just say, yeah, it really does. It still starts with stress because the gut will
mhm,
feel that through that, that vagus nerve system. But then really the second is inflammation. Inflammation leads to everything else, right? Insulin resistance. It's going to lead to the body feeling unsafe. It's certainly going to
mhm.
put up that barrier and wall for the body to produce healthy levels of progesterone, to even release LH so that you
Right,
can
right.
release an egg. So it's such a loaded question. There's so many different aspects to it. Ultimately, I'm a test don't guess person. So when you do
Mhm,
to me, we are going to test. I want to speak very clearly to you about that. And so not only are
mhm,
we looking at the gut, but we're also testing hormones as well, both via the blood and the urine, to see what's going on so we can give you a really clear picture. And even too, we could probably throw in, the vaginal microbiome is important too. There's some really great testing options out there. The gut microbiome would still trump that at the end of the
right.
day. That has to be the most important and really healed and sealed. And there was this great study that, I read not too long ago, but they had tested, all of the vaginal microbiomes were normal in the set of women, but there was a higher incident of infertility and miscarriage when the gut microbiome was off. So
Mm,
that was really interesting just to see, even with the vaginal microbiome intact, all of that looking good, that there was still such an impact on that gut microbiome. And I just think it's very easily overlooked. If you're taking over the counter medications, if you're taking actual
mhm,
medications, if you're using things like PPIs, you take Tums every day for your acid reflux, you've had
mhm,
multiple rounds of antibiotics for whatever it might be, the gut has been disrupted from all of those things. And it gets disrupted every single day that you're under stress. Stress is
mhm.
still going to be that number one culprit of
The
really
leading cause of everything.
it really is. I mean, it's,
Yeah.
yeah, it's not like a broken record, but it really is. I mean, it's going to trigger mass inflammation. It's going to disrupt the
Mhm,
adrenal, and that's going to
mhm,
cause, all of this massive cortisol surge, dysregulation with norepinephrine, epinephrine. And yeah, I mean, you just get on this loop. I mean, that is the truth. You just you can't get off the merry-go-round. But I think that is such an aspect that's overlooked, so women that are dealing with
mm,
chronic constipation, the diarrhea, the bloating, the indigestion, all of that can absolutely, and most oftentimes does, it does impact fertility from a negative
Right.
standpoint. So that's why I always come from that place of, well, let's test it. We don't want to
Mhm.
guess. We want to
You
see.
don't
We want to
know
get
until you test. Yeah.
you don't know.
And I think
Right.
it's
Yeah,
also just like really eliminating that hostile environment so that you can start
exactly.
off on a good foot and not trying
Yeah.
to, live in
Mhm.
like hindsight. Let's try to fix this and fix that. Like really just kind of prepping your space before
Mhm.
you
It's true.
actually are ready for conception, right?
Yeah.
Yeah.
And I think that matters. I think it's something especially too for women that we don't really understand, but especially if you're having a vaginal birth, your gut microbiome is now going to be passed, right? So that's
Mm.
going to get passed to the baby itself, and especially the
Mhm.
vaginal microbiome too. So I think that's another aspect, right? So we have to be
Mhm.
understanding that what we're doing, the health of our body, how we're taking care of it, does affect that baby too. And so, yeah, I
Mhm.
mean, the more that you set yourself for success, the likelihood of your baby, your children having really healthy, strong immune systems goes up even more.
Absolutely. I love that. Thank you.
Yeah.
All right. So, if for anyone listening right now and they're like, okay, I'm ready, I heard everything that you said, I'm ready to do things differently, what would you say is one simple way that they can start supporting their body more intentionally?
I would say so. Well, we gave the stress. Yeah, we gave the stress. So let's talk a little bit about the digestion aspect. So, one of my favorite pieces is before you have a meal, really try and sit down for your meals.
Mm.
Try not to eat
Mhm.
standing, try not to eat in the car or in front of a screen, because the brain sends the signals to the stomach when you see food, when you're physically touching it, when you're smelling it. So, all of those preparation techniques, that's when the brain sends a signal to the stomach. Hey guys, we're about to have a meal. Let's get everything working. So, really, A, sitting down for your meal, but B, take 3 calming deep breaths before you eat. You can have that moment of gratitude, express prayer, and then have your meal. So, really try
Mm.
and eat calmly. I say for high functioning, busy moms, dads, anybody, even if you do this one meal, if you aim to do this
Mhm.
one meal a day, if you're like, I can't do all 3, that's okay. One meal a day is still going to make a huge difference.
Mhm.
So, even just doing that, taking those 3 deep breaths prior to eating and sitting down, try really hard to sit down and
Yes. I
eat your meal.
love it. Love it. Love it. I'm like, don't rush.
All
One of the
rush,
things
don't
that I
rush.
always say, I mean, there are terrible, terrible things that came out of 2020, the couple of years to follow. But one of the things that I always say I am very grateful for is always just trying to find like the silver lining in everything. It really was a time, a year, if nothing else, to slow down. Everything slowed down. You weren't doing sports or running from here to there. There weren't as
Yeah.
many cars on the road. You had some more time with family. Everyone was growing a garden in their yard. Like,
Yeah.
and really just appreciative of what's in front of you and taking
Mhm.
that time to like, I love to enjoy my food. I've always been a slow eater. As a child, it was like painful for everybody else, but my parents were like, well, you'll sit and you'll just like finish until you're done and then that's it. But always the last one, like you go out somewhere and it's like, oh, she eats slow. School was very stressful. I went to a private school, Catholic school, and they're like, you got to eat your lunch in like 15 minutes before you can go out for recess. And I've always been that way, but even to this day, I'm like, I love to enjoy my food. It's a very, you're not just tasting the food, you're smelling it, you're looking at it. It's like visually appealing. It's a whole experience for me. So I love to eat. I want to enjoy it. And I think
Great.
that's really important is just like being appreciative, taking that breath, and then not being distracted by something else,
Mhm.
because then you can't get those cues if you're full or not, or, if you're satisfied or, what you want to do next. You
Yeah.
miss those cues. You miss your body telling you what it needs next.
That's so true. I think too, for a lot of us, especially moms, again, if you're preparing food for your family, you don't even, like you don't even really get to enjoy it. And same as you, I don't know if I was always a slow eater, but I've always enjoyed the food. I love
Mm.
cooking,
Mhm.
and like I want to taste the flavors that I just spent, the last 30 minutes
Right.
preparing or whatever it was. And it's a really calming experience for me. I know a lot of people, that's not how they feel, which is fine. But I
Mhm.
do think when you look at, again, other cultures, other societies, that's not how they eat. It
Right.
is very relaxed. They're putting their
Mhm.
fork down, they're having intentional conversations, they're sharing
Mhm.
a glass of wine. They're really invested in the people also around the table. And I think
Yeah.
that's something that is missed, going around and
Mhm.
how was your day? Tell me about, really having that
Mhm.
connection where we've all lost it. because of these,
Right.
and we're right all on our
Yeah.
phones. That's, I think, a missing piece that we can bring back to those tables where we're not having phones, we're not having
Mm.
technology. Let's really be intentional, not only about the eating practice, but about each other.
Right. I absolutely love that. So,
Yeah.
so good. All right. So, we're going to wrap up. I have one last question for you. And I don't know that you can give just one answer, but if you could give out a prescription for any of our listeners right now, just on gut health and fertility, what would that prescription be?
Oh gosh, that's a really tough one. I would say it would be, I mean, the stress management is so important, but honestly, I'm going to go with do something that you love. Find joy
Mm.
every single day and do it.
Mhm.
I think
I love
that
that.
is, yeah, I just think there's something that we're missing in terms of who we are as people. And I think a lot of times our identities get wrapped up in different things. It could be our
Mm.
business identity, it could be our, personal, in terms of I'm just a mom, but you're not, right? You're not just a
Right.
doctor, you're not just a mom. You could be a sister, a friend, an aunt,
Mm.
a niece, you could be a daughter, right? You are so many other things than just that one
Mhm.
category. And I think finding your joy is crucial. It could be a hobby that you used to do when you were 12 years old. It could be something that you have a newfound love for, but finding that would be my number one prescription for today.
Absolutely love that. Find your joy, right? What are the things that you love to do? And just going back to that is really, really important. This was such a great conversation. I cannot thank you enough for being on today. I hope everyone who's listening in enjoyed this conversation as well and really just learned a lot about your body and gut health and that connection. And you gave great, simple tips that people can implement right now and be able to do. That's not going to take a lot of time, a really simple habit that you can just kind of build on to really get the results and that transformation that you want in your health and changing those things little by little. So I think that's really important. Before we wrap up, Danielle, can you just let everyone know where they can find you if they're interested in learning a little bit more about gut health and fertility?
Yes. Well, thank you again so much for having me on. I absolutely enjoyed my time and just chatting with you. But yes, if anybody is interested in exploring more, you can find me on social media on Instagram with revive_health_wellness. You can also email me at Danielle@revivehw.com. And my website is also available, revivehw.com. So those are the three modalities that you can get a hold of me. I'm always on social media and happy to answer any questions that you may have.
Thank you. And I'll make sure to drop that below in the episode description as well for anyone who's listening or if you're re-listening. Everyone listening, this is your invitation to stay curious, to ask deeper questions, and to really just be your own self-advocate, trusting yourself and your body and what your body is telling you. So you deserve more than just normal. You deserve to feel well. All right, everyone, cheers to your health.